I'll talk. I'll discuss this issue from the clinician's point of view. When I started practice in '81 in Tanzania, I think access to insulin was a major issue. And then we had this paper from John, where it said that child would not live for more than a year in sub-Saharan Africa. And we, as taking the model in Tanzania, we said that we need to do something about it. So the first challenge was, how is insulin being brought into the country? And you find that main importer was the medical stores department from the Ministry of Health. And the medical stores department would basically calculate the consumption required for insulin based on the data or the information they get it from the districts and the regions. And unfortunately, the data capture was very poor. So you find that there's always a short supply of insulin coming in. And this short supply of insulin coming in predominated by Novo and Ella Lilly, so the two companies which predominated the supply route at that time. So as an association, as the community approach and trying to build up the association and trying to see how we can actually move the government to see that we have much better access to insulin. So we started strengthening the association, but at the same time, we started having some funding from the International Diabetes Federation for the Child Survival Program, whereby we started providing insulin to children. And this insulin came in, and that started giving us experience that what would be the supply chain for insulin. In the meantime, we had some students from the business school, Wharton Business School, who came to do some elective study looking at the supply chain and the costing. And if you look at the costing of the drugs, when they are imported, if you take a drug which is 5 units, by the time it reaches the consumer, the cost would increase by more than 200 to 250%. And it would be different levels of marketing or different levels of markups, which you would see that the cost would become quite huge. And at the end of the day, even a simple drug would cost about 200% more than what it should be costing in the market. Now, having availability of insulin, if you are, as a health budget, if you are at the district level and if you are the district medical officer, your budget, you are given certain amount of money for buying the medicines. So you look at what are your priorities. So if you buy insulin, that will consume 50% of your budget of the health at that hospital, while the remaining 50% is to cater for 90% of the diseases which are there at the district level. So the priority of the district medical officer would not be insulin, would be how many more people can I manage with a little budget. So the whole game plan had to change, that how do you actually change the mindset of the people saying that this is one of the essential drug, which is life-saving drug. Currently, we have more than 2,000 children in Tanzania on insulin. They get continuous supply of insulin. But the second challenge now is to making sure that these children are taking their doses on time. Because you find that when you give them insulin, the parents, the community, they say that, okay, the insulin, you are doing well, so instead of taking 3 injections, they take 1 injection. And you have some parents who basically, because there is no food, and they can't eat, and they have to take 3 injections a day, and if there is no meal available, they skip the injection. So you find that those are the challenges. So I see from the clinician's perspective, what I see, one, availability of insulin is there. Affordability is a question mark. Even if the generic insulins are there, they are only 5% cheaper than the original insulins which are in the market. So the generics are actually riding on the wave of the original suppliers and making profit out of it rather than really cutting down the costs. So the generic suppliers have to cut down the cost if we really need to bring affordability as an issue. And then comes the availability. And availability, again, would be that at a different levels or different levels of the health system, how do we ensure that this insulin is available? Thank you.
Thank you. Thank you not only for inviting me today, but for the huge work that was done